Sure. So he was born when? Yesterday?
At 9:30 in the morning.
Okay, so this is our new full exam. We're going to start looking at their eyes. Make sure they don't have any entropias, they look normal, no abnormalities. Mentation, he looks pretty good, it's a big boy. We look at the mucous membranes. Newborns don't have any teeth yet. Make sure they have paired mouth. Mucous membrane look good. Then with my hand I examine, always wear your gloves. Examine their soft palate, trying to see if we have any cleft palates or abnormalities. He looks very good. Then I go to the back and I like to touch their umbilicus. It has a nice and firm stump. And then his inguinal area. He's a boy, he has 2 testicles. Make sure they don't have any inguinal hernias. I like to assess the back of it. It's normal. Doesn't have any pieces or extra things. Now we're going to have our heart rate. I'm going to listen to him. Other side, both sides always.
You can read a comment if you want to say,
Okay.
feel like answering something. You don't
Now
have
I'm going to listen to his GI. Make sure that it's moving. It's good.
There's 700
All
people
is
watching.
not bloated or dilated, everything. I like to see his conformation. And now the part that they hate the most is actually touching his ribs. Make sure that he doesn't have any broken ribs. So I go ahead and put some pressure. I
How
was going to
old's
tell you
the
that,
colt? 12 hours-ish?
Yes.
Yeah, it was born about 9 o'clock yesterday morning, outside at a client's farm that I went to assist.
1 day old?
Yeah, and then trailered it over here so the vet could check it this morning.
So I'm very suspicious of his left side. He has some swelling. I can't really make the rib click, but it's really kind of swollen and feels different. So to confirm that he has a broken rib or not, oh yeah, I felt it
I heard
actually.
it then.
Yeah, so he does have broken ribs on the left side. He has one in the back, which is good because you don't want it to have it close to the heart, because if close to the heart, they can punch the heart, and that's never good. I heard that, so I did that. And then he has some swelling on the left side. So to confirm that, we can ultrasound it for sure. But this foal, since he has broken ribs, he needs to be in the stall for 2 weeks until make sure that those ribs are going to be very firm and they won't puncture into the heart, okay? Or any kind of organ that is specific. So now he's going to get his plasma. Not all foals need the plasma, but we're trying to do it since we're a breeding farm and there's a lot of foals born and there's a lot of disease. This guy most likely will travel to Kentucky or stay here. We don't know yet.
He'll probably go to Kentucky.
He will go to Kentucky, so we're going to give him his plasma to just provide extra immunity. And yeah, and then we'll pull a blood with a CDC to make sure that his white blood cell counts are high and normal. And I'm going to give you a little bit of pain medication for his rib. I'm pretty sure it's kind of
There's
sore.
a lot of people asking, is it normal to have broken ribs?
Yes, actually it is normal. The mare, I mean, she's pretty big, but this foal is large. And when they go to like the birth canal, the mare and the pushing, it can like break the ribs when they go. And it's, I found a large amount of actually, of course, that have broken ribs. So
They usually heal and usually not a
they
problem.
usually heal. Some of them are worse than other ones. I wouldn't say that this one is not so bad, just a few. They're far away. They're kind of like in the other side around here. So if you get a bunch of them broken close to the heart is when I'm concerned, okay? Start rest, anti-inflammatories. They will come back and check them again. Make sure that nothing is punctured, so yes, okay? Any other questions for now?
Is it painful?
Yes, it is painful, but they tolerate very good. So we're trying to give him anti-inflammatories for the first 3 or 4 days of life, and
Make sure they encourage him to
Kathy
keep
will
nursing.
like
Yeah.
monitor nursing, and they do pretty good, even if they're broken pretty hard. So now Emily over here is going to start scrubbing. It's my assistant, my sidekick. She's going to start scrubbing the right jugular vein so we can do a plasma administration. And I'm going to get ready. I'm going to ask Kathy to put the Foal towards the back because I'm going to block it with lidocaine so he doesn't feel the injection. And the beginning is always hard. They don't like it, but they're pretty good about it. Yes. Maybe we can try to like ultrasound that and see if it's so really fast that way so I can so he doesn't go back. So this is just the lidocaine that I'm putting under their skin. And Kathy's just holding the head, so she's not actually holding any ear or doing anything like that. We just keep it still so he won't hit me in the head. Okay, good. Emily's going to scrub one more time.
Those cool pants now too.
Oh, I've had these.
Oh, really?
Yeah.
How do you dream too?
Really like them for some.
They look really comfortable.
They are. I can't really move into some of that.
Actually, the ones we changed to. Spring time of year.
And just hold my spray.
Go on, Mike.
And there.
I don't have to show up.
To put a few sutures to keep the catheter in place. So I like to do my plasma standing with no sedation. So that way we can see, sometimes folks will get some reaction. And so we start slowly, but I like to see them walk around, doing normal things. That way I can assess how they're doing. Oh, it's okay, it's okay. Watch your hand. Slapping Kathy's hand out of the way. No personal space. That's okay. Yeah, you're fine. You're fine. Nobody's going to hurt you yet. A really cute boy.
He is, isn't he?
Yes, you are. Yes, you are. Yes, you are. You're a good girl. One more. There it is. You are okay. Oh my goodness. Yes.
Go, go, go.
Okay, there he comes, Emilio Pasado. One of my things. Stand up, stand up. Isa, you're okay. Come on, you're back there. Okay, bottom. Okay. This is a bottle of plasma. We make sure that we're 100% in the vein. Yes, we are.
That's a good question. Why are they giving this?
Okay, so I said that before that, you know, we have a very big volume of horses, and these horses are very valuable. So there's different kind of plasmas for different kind of disease that the foals will have. And Emily, give me 2 cc's of ketofen, please.
Yes.
And so we provide extra immunity to these foals. They're very valuable. They travel. They're born in a high concentration of horses, not in this case, but some of them they do. So we just want to provide them extra immunity. And in this case, we're giving a plasma against Rhodococcus equi, which is a lung disease. It's a bacteria. It produces lung disease in horses from like 1 to 4 months old, and they're like very big gases. So we're trying to give it the best immunity for them, so they have less likely to develop the disease. So
It
yes.
can't hurt, so we might as well be
No,
proactive.
absolutely, it's really good, yes.
There's a lot of heart popping up.
Oh, that's good, thank you. So yeah, so we stand over here, giving our plasma nice and slowly. And Hasaro can come over here. It's another veterinarian, he works for us. And while he does that, he's going to check. I'm going to check the mare. I know that Kathy already checked the placenta and looked good. So I like to check my mares.
She wasn't
We-
opened because she wasn't
That's
here,
okay.
so she
We
told me.
always like to check I'm going to show you guys. Somebody make sure that somebody holds the horse because mares can be fun. Trying to be nice and kind with them. Hi, you're huge. And I'm pretty tall, I'm 5'8".
I don't
She's
think they can
huge.
see her. You can unplug it if you want to move it.
Look at her mucous membranes, it looks good. Some post-folding mares will have some bleeding or colic. She is gigantic.
I call her Zeus.
Oh my goodness, yes. Heart rate, normal heart rate in a horse is around 40 to 44, 32. So,
Pick a number.
I have a
Which
no-
one is
I'm
it?
right here, normal heart rate. Good. I'm going to listen her GI. Good. We're going to move it forward. And we're going to check her back end where the foal came out. Kathy's right, so she kind of ripped a little bit, but other than that, she looks pretty good. I will fix her calf legs. So 3 or 4 days post-foaling, we will do like a spec calf legs. What I do is like, I check their back end, their vaginal area, make sure it has no tears, no discharge, and we'll flush the uterus. We'll put our hand there, make sure that horses are nice and clean, and then we'll suture their vaginas or caskets because it becomes pretty open and air goes over there and actually the uterus gets contaminated. So there's our little patient over here. We give him some anti-inflammatory, so he's got a bee stay in the stall. His legs are pretty correct, so I always look at, doesn't need any bandages. It's slightly wing swept in the back. Actually, if you put it, his bad out, you can see, we call them like wing swept, but this will correct really easy. He just needs, you see how he kind of like goes sideways? So he's hopped, but I'm not really worried about that. He's just only 24 hours. He will get better with time, so we just gotta give it time. Other than that looks normal. We'll pull the blood, and I will get back with her later about his blood work if he needs anything else. I don't like to give antibiotics if it's not necessary. Only do it if you have a problem. That's why we do the CBC. We don't want to use a crazy amount of antibiotic if it's not necessary. So I like to do what's necessary. That's why we give it antibiotics and plasma, and we look our foal to see if it's doing the right things. And he was doing good.
Oh,
He
he's
was,
doing really
okay.
good, yeah. She
Okay.
tear enough just to put her on some S&Zs? Or
Yes,
just
you
rub it
can.
here at
Yeah,
sea?
you
What do
can.
wanna do with her?
Yeah, you can. We can put him on some. She doesn't look bad behind.
No.
It's just sideways.
Yeah.
I gotta fix it.
Okay.
But we can. The kiddo looks good, so we'll go from there.
They want to know what the baby's name is.
Oh,
It's a client's horse, and they usually let actually it's their son's birthday today, so they'll let him name him. He usually comes up really cute little
who's
barn
he by?
names. This one is by Rock Your World.
Okay.
I
All
think.
right.
Double check with. I'm
Yeah.
sure it's
So
Rock Your World.
when we're done with the plasma, this is going to be 1 liter. When we're done with that, we'll actually pull the blood, and then we'll take the catheter out. It's just only a partial catheter who goes in the vein. I like to look at my catheter. That's how to put your back. So you see okay, good. You see the blood coming out. So that way, if it goes out of the foal, falls down or wants to do something not so smart, some of them, they're really hard. I know that my catheter is nice and in position in 3 spots, so it doesn't rip off from the vein and we don't make any damage to it. So that's how I like to do it. And it's standing. That way we can see that he's actually nice and happy, taking it okay. He can go nurse and do his normal full things. And in the first 7 days or 10 days, you actually can play with them because they have no teeth. After that, it's a different
bite you,
game.
yeah.
Yeah, they will like attack you. Not attack you, but they can hurt you. Yes, they
Not
can.
intentional.
Yes, they can. Yes, they can. You're a big kid. Look at you.
I didn't get to do it yet, but he did notice he was wagging his tail quite a bit
Okay.
in between last night. I'm just wondering if he might have a little blood and stuff.
He's okay. So far, he's being okay. Hopefully, he will with the plasma. Sometimes the plasma will make them like defecate and have like a bowel movement, which is good. I give him some pain medication for his rib, okay? And so he will stay 2 weeks.
But they're not too bad. You don't want to do that again in a couple of days.
The what?
The pain meds again. It wasn't.
Yeah,
that bad
we
to
can.
do that?
Yeah, no, if he's fine, you can give him some oral Equiox, and if not, I think he'll be okay. He has a little bit of swelling over there. That's why I feel, and then one in the back that you felt the crack too, did you?
Well, because we had to try and carry him inside.
Oh my goodness.
I was just trying to like keep him up
Yes.
and forward, and then Shane was trying to keep him
Yeah,
up
and
and
it's
forward.
important that they know also that when you're trying to hold a foal and it's laying down, never grab it by the ribs. Some people
Right.
grab it by the rib cage and pull them up.
Yes.
So always grab it by the elbows over here and by the back, and then that's how you can like lift them up. And sometimes I kind of grab a little bit of their mane without actually pulling it, but that's how like I get them up from there, but never around the rib cage. That's
Yeah.
really important because they're very fragile when they're born. You have any questions?
Really?
Yeah.
So he's a very healthy little boy.
Yeah,
I
so
think
far,
big
so
boy.
far.
Don't jinx it.
No, won't jinx it, but you know, foals they change so fast. I mean, they can be fine and then they're not. So we keep a very close eye on them, and we're trying to never wait until the last minute. And we're always proactive. Kathy over here, she's really good. She always calls me in a nice time if something goes wrong, so we can address it, and we don't have to do it in the middle of the night or things happens. But we're trying to do our best. So nothing goes like as everybody wants perfect. There's not a perfect word, that's for sure.
Where does the plasma come from?
Plasma come from a plasma company, which is my favorite plasma company. I can say that's MG Biologics, and so it's a very good plasma company that we buy different kind of plasma from them, and they're great. Their IgG levels are really high, especially in rhodococcus, and they're tested. They're based of Iowa, so it's MG Biologics. Very good company, awesome. Almost done. Almost done.
Or are you asking like, how do they get these plasma? Or?
Mm-mm.
No.
Lots of questions about the ribs,
The ribs.
but other people are responding back
they're
to.
really-
that's okay.
Yeah.
People are paying attention. They
Yeah.
actually help, and-
Hey, bring the ultrasound machine.
Okay.
Maybe we can ultrasound and see if I can see it. But I'm going to ultrasound the ribs. So ideally, if you have a question on the ribs, you can ultrasound it, or you can tell the veterinarian to ultrasound it. You need to have a lot of practice. Some ribs are really easy to feel. They will crack right away when you put some pressure. Some of them they're not. So sometimes one side is concave. If the side is concave, I like to ultrasound it. And I don't see fractures. I'm okay with it. I leave it like 7 days in the stall and then become harder. If I have a question, I like to ultrasound it just to be sure. It's amazing the different kind of things that you can find and you cannot feel because the rib doesn't displace, and then you just can't make it click, but actually you can see it in the ultrasound. So we'll try to see if I can get a good image that I can show you guys of one of the ribs that he has broken, and then we can count how many, and that way we can monitor. And around 15 days I will check it again, make sure it has a good callus form and no displacing, and then he can start going in a little paddock, and then after the little paddock he can go in a bigger paddock, and then he have a normal life, hopefully. Yes. Yeah, you are a big kid over there. That's why you broke your ribs coming out of there. I don't know how. It's kind of amazing to think how this such a large animal fits through like a space like that. It's actually it's amazing. It's amazing.
The one that Dan was trying to do with the other day when it was upside down. Dan couldn't try to get his hand in
Yeah.
underneath the hip. His hand literally was hurting for days.
Yeah, and then after
Such a
that,
tight
Emily,
squeeze.
my tech, she's going to pull the blood. I have a good team, so everybody have their little spots
job.
and learning. Yes. Mercedes over here is visiting from Argentina.
Hi.
Yes, she works with Foal too.
Unplug it, just
Just charge
Something
it
like
up.
that.
Emily, come over. So we're going to pull blood out of the catheter. She's going to do some waste blood, make sure that we don't have any plasma, and we have appropriate sample for our CBC and IgG that is run in our clinic. Okay, good. How do you want to pull the catheter for me?
I know, you're getting hungry. We're almost done.
And then you have the other scissor for me. You can show them how you put it in little tubes if you want.
Putting our blood in our blood tubes.
It's okay, come on, stand up, bud. It's windy now. Where is the 60 degrees weather? We're supposed to have in upstate New York. You have the other scissor, Emily? You do? And then we can move it over here. Around, so the catheter is out, you see. I'm going to put a little alcohol and elastic wrap to ensure the blood is not dripping or it doesn't become a little bit swollen. I leave it for like about an hour and then Kathy will take them off later. Just a little elastic wrap around it. Alright, now we can do the ultrasound. So if you go around, Kathy, please. Where are you going? Bring me the alcohol, please. And then if I can find an image, a good one, I will freeze it in my ultrasound and I will show you guys close. I just gotta look for it. So a little bit of alcohol. Hi, is that ticklish? Oh. Don't fall. Don't fall. You're okay. You're okay. You're okay. Let's see if we can find anything. Oh yeah, right there. Okay, Emily. Hold on. It's breathing, so that's good. Oh, and freeze. Okay, so I'm going to, I don't know if, can you see it over there? So this is the rib, okay? And the rib, and there's a gap. And you can see the broken rib over there. There's a little bit of swelling and inflammation. So I know that has a broken rib. So when he, in about 2 more weeks, hopefully we'll see like a callus, which is going to become very white. And that is not going to be able to click anymore. So you can see the ribs. And I'm going to look for some more, I think. So, but the good thing is back, so it's not close to the heart.
How did the ribs break?
Most likely they broke when the foal was coming out of the birth canal. As you can see, the mares have a small passage and they put so much pressure going, and this thing is like 120 pounds. The mare is big, but the space is not so big. So the big pushes that they go through, the ribs are very flaccid because you wanted to do that. It's kind of like when you have a baby, you know, it's everything, the bones are all flaccid. So most likely when the mare like push hard, that's how the ribs broke. And that is a good one over there. Okay, stop. Okay, this one is a good view over there. That's another rib. So the bright light, like this white over there, is the rib. One is the same rib in the other one, and there's a gap, and that's broken. Okay. Good. Yeah. Oh wow, that's a good one too. Well, yeah, no, we have a bunch because remember that I said that it kind of felt, no funny, but like it felt different and a little bit swollen. So cranial, okay, and freeze. So cranial, there we go, another one. Rib, and that one is broken. So it's like this place is like riding over, but I can't make it really click. And I don't want to put so much pressure because there's a lot of tissue over there, which is good. That's a little more forward. So he has like 3 or 4 broken ribs. So we're going to monitor, and I think he's going to do pretty good. Knock on wood. So, yeah.
I guess there's nothing you can do for them, or how do you fix them?
I'm good. So when they are, Mercedes, you want to like just touch it because you can see that there's inflammation over there. Hold it, yeah. So there is surgery options. Do you see that they're like swollen? But I can't make them click. I can actually click that one from the back, but this one over there looks suspicious. It's just like a little swollen. So when they have a lot of broken ribs, and the foal is actually in distress, or it's bleeding into the thoracic cavity, or there's just too many and it's very dangerous, we can have surgery, but it's very risky. They can actually put some like plates on it to stabilize the ribs to stop making more damage. But in this case, I'm happy, didn't go through any structure. We try and you know, it's risky to do a surgery in a newborn, so unless the foal is like really compromised or not, you know, it's really severe, we do surgery, but it's, you know, it's very risky. In this case, we're going to monitor, he's nursing, he's doing the right things, he's happy, we're just going to let it be and heal. Yeah, that's it, I guess.
Yeah, check on him in another couple of days. Thank
Yeah.
you so much.
Bye, Mama. Good job. Bye. We have to flush one there faster.
PG?
Appetizing.